Good evening, everyone. My name is Ikwaba Amarachi Gold, and I will be taking the tutorial for Sci 434 Rehabilitation Psychology. And today we will be discussing what is disability. We'll be discussing about disability. So basically, we know that the role of a rehabilitation psychologist is to help people with disabilities and chronic illnesses. So, what is a disability? It says it is any condition or impairment, socially, cognitively, developmental, intellectual, mental, physical, sensory, or a combination of multiple factors that makes it difficult for a person to do certain activities or interact effectively with the surrounding world. So we know that disabilities limit individuals. We know that disabilities inhibit individuals from doing the things that they'll be able to do. If it's physically, maybe they are unable to move, maybe they are unable to participate in activities. If it is mentally, they can have mental disorders that limit them from being able to function properly like other people would. It could be intellectual, it could be sensory, it could be social, it could be cognitive, it could be developmental. Now, these disabilities lead to extreme discrimination and disadvantages. So, social perception of themselves can be low. This can inhibit them from engaging in social activities. Even when they try to engage in these social activities, they might be met with, limitations. They might be met with people not wanting to interact with them. They might be called names, insulted, they are labeling, and other things that are caused by discrimination and stigmatization. So we have to manage these persons with disabilities by with care. We have to make sure that we are helping them consistently to understand what is going on with them, to face the challenges that are going on with them, and to move on from these challenges, to be able to incorporate these challenges, incorporate the situation into their self concept and know how they are going to work on it and function better despite these challenges. And we must know that there are some general causes of disabilities. First one we have is chemicals. Some chemicals are very disruptive to the brain, to the body, and some chemicals can be used to make nuclear weapons. All those things can affect how a person is physically, or a person is mentally, or a person is cognitively. We also have poverty and malnutrition. So people that are poor and are unable to get proper feeding, are unable to get proper nutrition, are unable to take care of themselves, they can be more prone or more at risk of disabilities. We have inherited diseases. We've talked about the genetic factors. People can have trisomy 11, trisomy 21 rather. There are other disabilities that come genetically and are inherited. There are nuclear accidents, people that have suffered from cancers. So we talked about cancer being a chronic illness that can affect how an individual interacts with people, that can affect an individual physically, that can affect an individual psychologically as well. There is war, explosions, bombs. We can see what's happening in the world around us and how war can affect people and how wars can lead to disabilities. Poor access to health care. Somebody that is having maybe a developmental disorder, if this person had access to health care, they can be help that can help them to limit or minimize the damages caused by these developmental disorders. But if they cannot access healthcare, which can also be linked to poverty, maybe they don't have the finances to be able to go about it, that can lead to more problems, that can lead to the disability giving them more challenges. There are also illnesses, medicines and injections which can affect an individual and make them to have a disability or a chronic illness. So we say that in general terms, disabilities may be associated with different conditions at birth that can affect them or later in life. So disabilities can come from birth or they can be congenital. They can come from birth, which is congenital, or they can be accidental rather. So you can have people being born with disabilities, just like I said, trisomy 21, and you can have people that encounter certain accidents which can lead to disabilities. So injury, for example, can lead to disabilities. So dimension of disabilities, we understand that there are three dimensions of disability. So there's impairment of the body structures. So, for example, if a person has lost an arm or lost a leg, that's an impairment of the body structure. There is activity limitation. So, if you've lost a leg, you might be unable to move, your mobility might be limited. So, that is an activity limitation. And there is participation restriction. So, that might inhibit them from doing activities such as playing in football, maybe playing in basketball, because maybe they are unable to move in the way that other people move. But that's why, we have some additional technology that helps people with disabilities and chronic illnesses. So what are the types of disabilities? We have physical disabilities, we have intellectual disabilities, sensory disabilities, and mental illness. So physical disabilities, they affect the person's physical capacity and mobility. So we talked about people that might have lost an arm, lost a leg. Those are physical disabilities, visual impairment, all those things. So types of physical disabilities, we have acquired brain injury, we have spinal cord injury, we have spinal bifida, cerebral palsy, and so on and so on. We have epilepsy, we have other disabilities such as that. We have dwarfism even. So then we have intellectual disabilities. So intellectual disabilities can be caused by brain conditions, they can be caused by genetic conditions. The example of trisomy 1 is one I always give because it's very easy to understand. People with Down syndrome, we can see them having some intellectual disabilities. We have fetal alcoholic syndrome as well. We have brain malformations, we have injections, there are certain injections of steroids that have led people to having certain disabilities. We have exposure to toxins, we have serious head injury, we have stroke, maternal diseases, problems at birth, extreme malnutrition. So intellectual or cognitive disabilities, they can limit how people are able to function intellectually. They can limit how they are able to how their intellectual quotient is. They might have a lower intellectual quotient score, and this can impair how well they are able to function in things like school, work, academically. All those things can be limited by their intellectual disability. So their practical functioning and their intellectual functioning can be inhibited due to this disability. So symptoms of intellectual disability, we have significantly delayed motor skills, we have delayed speech and difficulty speaking, we have difficulty learning, we have poor memory. So we know some intellectual disabilities such as autism spectrum disorder. The same people with autism spectrum disorder, they might have difficulty engaging with people, with people socially. They might have communication difficulties. They might have repetitive behaviors. Continually repeating words that people say. But autism is obviously, as the name implies, it's on a spectrum. It's not everybody that has this. It doesn't come the same way for everybody. People who have autism in different ways. You can't just see one person and think that the way this person acts is applicable to everybody with autism. So we also have learning disabilities. That where in learning disabilities they are unable to process information or receive information the way other people are able to do so. Then we have the sensory disability. Sensory disability refers to impairment of the senses. So, for people who are visually impaired, for people who cannot, hear, for people who cannot taste, people who cannot touch, smell, those things are sensory disability. So when we see people who are unable to hear, who are unable to see, who are unable to speak, those are sensory disabilities, and they limit how much an individual can participate or perform certain activities without help. So we have mental disabilities as the last one. Mental disabilities refers to mental disorders, and we know that you can classify mental disorders using the DSM-5 and the ICD. So this helps in clinical diagnosis. It helps us to understand what an individual is going through and to be able to create an appropriate treatment for this individual. For mental disorders, we have anxiety disorders. We understand anxiety disorders to be fear and worry that interferes with daily functioning. So it is unreasonable fear and worry. So this person can have different types of anxiety disorders, such as social anxiety, specific phobias, panic disorders. Those fall under anxiety disorders. Then we have mood disorders, we have psychotic disorders, we have personality disorders such as BPD, we have bipolar disorder. Those are personality disorders. We have eating disorders where people have, disproportionate concerns of food and weight, so that inhibits them from eating just like other people will. That inhibits them from, maybe they make sure that they eat only a few times a day, or maybe they don't eat at all because they are worried about their weight, or they are worried about how other people would perceive them. Those are eating disorders. We have sleep disorders, we have sexual disorders, substance use disorders, dissociative disorders. Those are disorders that fall under mental disorders. Substance use disorders, we see people that engage in drug use and are addicted to this drug, and without this drug they are unable to function or perform their daily activities. They have sexual disorders such as paraphilias, those paraphilias can affect how an individual functions. We can have necrophilia, we can have pedophilia. Those are paraphilic disorders that affect how an individual functions. So these are the disorders, and these are the examples of disabilities. We said sensory disabilities, physical disabilities. I think I might have mistakenly put visual impairment under physical disabilities when I was first speaking, but visual impairment falls under the sensory disability. Physical disabilities refer to physical limitations. Sensory disabilities refer to sensory limitations. Mental disabilities refer to mental limitations and disorders. Then we have intellectual disabilities, which refer to cognitive limitations that can occur in an individual. So these are the types of disabilities that we have, and we just know that these disabilities affect the all spheres of an individual's life. Thank you.